Do you have radiating pain from your low back into your legs? Is it so bad that it affects how you sit, drive, lay, even stand? In this video, we're going to share with you some tips on how to sit, stand, and lay so that you can have less pain. We're also going to share with you the biomechanics of your low back so that you can understand a little bit about what might be causing that back pain. Hi, I'm Dr. Mimi, a chiropractor in Walkersville, Maryland. What this channel is about is giving you tips and strategies to revitalize your back and neck health so you can live with abundant health and energy so you can live your best life. Our motto at McLaughlin Family Chiropractic is empowering lives one spine at a time. Be sure to watch right to the end because I'm going to give you 2 bonus tips of what you can do if this pain doesn't diminish significantly by doing these practices. If you want to receive more of these tips and strategies, click on the like button as well as subscribe to our channel by clicking on the notification bell. The first posture we're going to talk about is sitting. Many people sit many hours a day, and sitting can aggravate your low back. So if you are sitting, make sure that your feet are flat on the floor. Make sure you're sitting back in the chair. Make sure you have armrests that are going to support your arms and take stress off your low back. You also want to make sure that your chair has a significant lumbar support in your low back. If you do not have a good lumbar support chair, you can get a cushion such as this, and that's going to sit behind you in the small of your back. You can use this in your car. You can also use this at your desk. So those are a couple tips. Another tip is to make sure that you get up and down through the day. If you're sitting for any length of time, that's going to aggravate your low back. So try to get up every 30, 45 minutes. That will diminish your back pain and also increase the blood flow so that you have less pain. The next posture that we're going to discuss is standing. If you are standing all day, you want to make sure that your work is at waist level. If possible, having a sit-stand desk is a great idea. It's going to diminish the fatigue that you're going to feel. You also can stand on an anti-fatigue mat. Wearing good shoes is very smart if you're standing. So you want to have supportive shoes. If you need to have orthotics or inserts in those shoes, that's going to diminish the back pain that you might feel. One thing that you can do if you are standing for many hours in many of the day, you can do what's called a standing cat camel. So we'll show you what that is right now. And what you want to do is you want to put your hands on your knees and you're going to extend your hips up and then bring your belly down. And you want to breathe into that. You want to extend your head, your back up, and then bring your belly down. That will alleviate back pain while you're standing. The third posture we're going to address is laying. So when you're sleeping or laying down, you want to make sure that your body's in good alignment. One way to think about that is you want to make sure that your ear is in alignment with your shoulder, in alignment with your hip, in alignment with your ankle. So if you're laying on your side, you want to, number one, make sure that your head's in good alignment. It's not craned up. To reduce that back pain, you can put a pillow in between your knees, and that's going to take stress off your low back. If you sleep on your back, you can also put a pillow underneath your knees, and that's going to take tension off the low back as well. Laying on your stomach will aggravate back issues. It jams the facet joints and is not a good position to sleep in. So avoid laying on your stomach. Make sure that you have a good supportive mattress. That too will alleviate back pain and help support you in having a great night's sleep. When looking at the ergonomics of your spine, it is very interesting. Why? Because your spine has beautiful backward curves, both in your neck and your low back. And in that curve is shock absorption. It's critically important to have those curves because when our body moves and bends, those vertebrae need to move properly. If you lose the curves, both in your neck and your back, it's going to put undue stress on the nerves coming out of that spinal cord. If those nerves are impinged, that diminishes function to every part of the body, whether it be an organ, tissue, cell, or the muscles. So it's critically important to have good posture, whether it be sitting, standing, or laying. We hope these ideas have helped you and supported you in reducing that back pain radiating down the leg when you're sitting, standing, and laying. Now it's your turn. Which of these practices do you find most helpful? Write in the comments below so we can know. So if the pain wasn't completely helped by doing these things, here are 2 bonus tips. Number 1, use ice. 20 minutes on, take it off, put it right on the affected area. That's going to help reduce the swelling and the pain that you can start doing right away. The second tip is see a chiropractor. The chiropractor is going to evaluate the health of your spine and to find out if you may have degeneration or not and what you can do about it so you can get back to living your best life. Please like the video and share it so that we can help other people that have back pain as well. Watch the next video on reducing pain if you have a herniated disc in your low back.